So, not having the most recent data could impact our ability to fund the programs that help to reduce and essentially eliminate disparities and mortality and morbidity for women in Texas.
Maternal health advocates say the state health department needs to release a report which includes some data on pregnancy-related deaths and disparities. Now, the Texas Department of State Health Services says the committee is still in the middle of reviewing 2019 maternal deaths. The data, which was supposed to be released in September, is now expected to be complete by next summer. Now, I spoke to KXAN investigator Deusen about the impact on mothers and what comes next.
A lot to unpack from your story, Arzo. And so there are some new developments. You did hear from Representative Theory today.
Yeah, we got an update. We've been checking with her regularly to see if she heard anything. A few weeks ago, she sent a letter to the state health department asking, where are we in this data? We as lawmakers need to have this data. And she tells us that as of today, she still has not gotten a response to that letter or questions answered. Now, she also sent that same letter to the governor's office, and she says they have acknowledged that they have received it.
Okay, and I think that's what a lot of people want to know. When will this data be released?
That's a good question. As of right now, the state health department tells us that's not going to happen until next summer, though maternal health advocates are working behind the scenes and they tell us they're pushing for this data to be released as soon as possible. Why is that important? As you heard in the piece, lawmakers want to know, where does Texas stand when it comes to maternal death and outcomes? And what can we do this next session, which starts in January, to help Texas moms survive childbirth?
And what are those advocates saying about how the lack of data, the outdated data, how that's impacting really care and those outcomes?
Jen, one of the maternal health advocates we spoke to and profiled in the piece, she says it's so critical to have this data because it impacts funding for programs that they are pushing forward. For instance, they are using outdated data to get funding. Imagine what they could do if they had up-to-date numbers. Right now, the public is looking at data that is about a decade old. These maternal health advocates say it's time the state was up to date.
Okay. And then lastly, what are the next steps?
Well, right now, maternal health advocates and lawmakers are pushing for this data to be released. They want to talk to the new health department commissioner and figure out what do we need to do as a state to get the review committee to get the data analyzed quicker. So the next few weeks will be critical in this as we learn more behind the scenes of what's going to be going on to get this data released.